Quick test. Before I say anything else, pay attention to the inside of your mouth right now. The tissue along your cheek. The roof. Under your tongue. Is it damp? Comfortable? Or is it the kind of dry you only really notice when you stop and actually check? Because if you're over 60, and you woke up this morning with that sticky, cracked lip, tongue stuck to the palate feeling, what you are feeling is not just discomfort. And it is definitely not just the cost of getting older. It is one of the most underread warning signs your body is capable of sending you. And most people ignore it because it feels small. I'm Dr. Anthony Fauci, and in my clinical work I have watched small symptoms like this turn quietly into pneumonia, into tooth loss, into bloodstream infections, into a downhill year that everyone is surprised by except, in retrospect, the body that was trying to explain it in advance. So today, I want to walk you through exactly what your saliva is supposed to be doing while you sleep, what happens when it stops doing it, why it stops doing it in the first place, and what you can practically do about it starting tonight. None of this is exotic. None of it is expensive. But it is genuinely consequential, and I think by the end of this you will look at that morning dryness completely differently. Please note, I am a clinician, not your clinician. What follows is educational information, not personalized medical advice. Please run any changes you make to your routine past your own physician and dentist, especially if you take prescription medications or have ongoing health conditions. Most of my patients, when I bring up saliva, look at me like I have just asked them how their elbow is doing. It's just there. It has always been there. People don't notice it until it's not. Which is a shame, because saliva is one of the more sophisticated biological fluids your body makes. It is not watered-down spit. It is a precisely engineered, continuously produced secretion that comes from three paired sets of glands: the parotid glands in front of your ears, the submandibular glands under your jaw, and the sublingual glands under your tongue, plus several hundred tiny minor salivary glands scattered throughout your oral lining. Those glands run in shifts around the clock, and what they pour out is not just water. Inside that fluid there are immunoglobulins, particularly IgA, the antibacterial enzyme lysozyme, the iron-binding protein lactoferrin, the digestive enzyme amylase, mucins that give it its slippery, lubricating character, bicarbonate that buffers acid, and a long list of peptides whose individual names you do not need to know but whose combined job description is identify, neutralize, and escort out anything microbial that tries to take up residence in your mouth. Every swallow you make, and you make several hundred a day without thinking about it, is a sweep. You are taking whatever loose organisms and debris are sitting on your oral surfaces and shipping them down into the acid bath of your stomach, where they are destroyed. That is not poetic language. That is the actual mechanical function of normal saliva. Saliva also starts digestion. The moment food enters your mouth, the amylase in your saliva begins breaking starches down into simpler sugars. Your food is being processed before it ever reaches your stomach. When saliva is in short supply, the first step of that digestive chain is broken before it begins. For older adults, whose downstream absorption is already less efficient than it was at 30, that early disruption matters. It buffers acid. After every meal, the bacteria in your mouth produce acid that, left alone, would start dissolving your enamel. Saliva neutralizes that acid and brings the environment of your mouth back into a safe range. Without that buffer, acid lingers. And enamel that sits in acid lingers eventually starts to disappear. And, this is the part most people never think about, saliva is what lets you swallow safely. It binds chewed food into a single, cohesive, slippery bolus, and it coats the inside of your throat so the bolus slides cleanly down the esophagus. Without it, food breaks apart in the mouth. Pieces separate from the main mass. Loose fragments drift toward the airway. The whole mechanical choreography of swallowing depends on this lubrication. Take it away and you are essentially asking your throat to manage dry crackers every meal. So why is morning the moment when so many of you feel this most painfully? Because sleep is 8 hours in which you are not drinking, not eating, not consciously stimulating saliva production by chewing or talking. Whatever saliva you were storing when you lay down is essentially all you have. And depending on how you breathe while you sleep, through your nose or through your mouth, you may be losing moisture far faster than you realize. Your mouth is a closed, warm, humid environment when you are awake. Once you fall asleep, especially if your mouth falls open, it becomes a desiccating chamber. Air moves across every wet surface. Mucosa that should be glistening turns matte. Tongue papillae crinkle. The biofilm on your teeth, that thin, sticky layer of bacteria and their byproducts, gains freedom it did not have during the day, because the thing that was regulating it ran dry. So when you wake up feeling sticky and rough, that is not a passing inconvenience. It is evidence. The saliva gate was down all night, and the occupants of your mouth took advantage. The clinical term for persistent, measurable reduction in salivary output is xerostomia. It is not just a feeling. Doctors can measure it, salivary gland function can be tested, and once daily output drops below a certain range, the cascade we're about to walk through becomes significantly more likely. Here's the part one want you to pay close attention to. Xerostomia is almost never one thing. It is a stack. And you will probably recognize yourself in 2 or 3 of these layers. Layer 1. Medications. This is the single biggest driver for older adults. The dry mouth side effect is not unique to 1 or 2 drugs. There are several hundred commonly prescribed medications that list reduced saliva as a known consequence. Antihypertensives, antihistamines, antidepressants and anti-anxiety medications, muscle relaxants, bladder control medications, anti-Parkinson's drugs, some pain medications, some diabetes medications, several classes of diuretics, chemotherapy agents. The list is long and it crosses every medical specialty. Each drug on its own may only mildly reduce salivary output. The problem is that older adults are often on 3, 4, 5, even 8 or more prescriptions at once, acquired from different specialists who don't always see the full picture. The effects of those individual drugs on saliva don't just add, they compound. They interfere with the nerve signals telling your salivary glands to release. They alter the composition of whatever saliva is still being made. They reduce blood flow to gland tissue. Imagine a factory where the orders keep arriving but the supply trucks keep getting delayed and half the workers are reassigned elsewhere. The building is still standing, the equipment is intact, but production has slowed to a fraction of what it should be. If you have been on a medication for years and your mouth felt fine, and then a new prescription got added for something unrelated, and over the following week's morning gradually started feeling a little drier and stickier, that is almost certainly not a coincidence. Gradual onset is exactly why so many people miss the connection. Please don't stop any medication on your own. But do make an appointment to talk about this with the prescribing doctor. Sometimes there is an alternative that does not carry this side effect. Sometimes there is a different dosing schedule. That conversation is worth having. Layer 2. Mouth breathing and sleep apnea. Your nose filters, warms, and humidifies incoming air before it reaches your lungs. Your mouth does none of that. If you mouth breathe at night, because of chronic nasal congestion, a deviated septum, enlarged adenoids, severe allergies, or because you have undiagnosed or poorly treated obstructive sleep apnea, then for the entire duration of sleep, dry unconditioned air is moving across every wet surface in your mouth. Picture a shallow bowl of water on a windowsill on a dry, windy day. 8 hours later, it is nearly empty. That is functionally what is happening in your mouth. Saliva cannot keep up with that evaporation rate. And the organisms that thrive in dry, low-oxygen pockets, the anaerobic bacteria, find that environment ideal. They multiply. Their byproducts sour the breath. By morning, what you are feeling is the residue of an entire population expansion that happened while you slept. If you snore heavily, if you wake frequently through the night, if you feel genuinely unrefreshed in the morning regardless of how long you slept, if a partner has observed you stop breathing during sleep, please bring this up with your doctor. Untreated obstructive sleep apnea is a contributor to dry mouth, but it is also independently a contributor to cardiovascular strain, cognitive decline, and daytime fatigue. The dry mouth conversation can be the door through which you walk into a much larger set of answers. Layer 3. Conditions that affect the glands directly. Dry mouth is sometimes not a side effect of something else. It is the primary symptom of a condition that needs its own attention. Diabetes is the most common. When blood sugar is not well controlled, the small blood vessels that supply your salivary glands are damaged along with the rest of the microvasculature. The glands receive less of what they need. And the saliva they do produce may carry elevated glucose in it, which functionally hands the bacteria in your mouth a ready supply of food. So you end up with less protection, less quality saliva, and a richer food source for the organisms you are trying to suppress, all at once. Sjogren's syndrome is the one that gets missed most often. It is an autoimmune condition in which the body's immune system mistakenly attacks the moisture-producing glands, the salivary glands and the lacrimal glands that make tears. The result is persistent dry mouth and persistent dry eyes that don't really respond to hydration because the underlying issue is glandular, not environmental. Sjogren's is more common in women, particularly in the years around and after menopause, but it does affect men as well. The diagnostic gap is real. Many people carry it for years believing they simply have chronically dry eyes and a dry mouth. If your dryness is persistent, doesn't meaningfully respond to drinking more water, comes with consistently dry eyes, and is paired with joint pain or unusual fatigue, please raise Sjogren's specifically with your doctor. It is not a popular topic in general medicine, and it gets overlooked. Other conditions that directly impair salivary function include Parkinson's disease, which affects the autonomic nerve signals that drive gland activity, rheumatoid arthritis and other systemic autoimmune conditions, nerve damage after surgery or radiation to the head and neck, long-term radiation therapy for head and neck cancers in particular, and certain stages of HIV. In all of these, the dry mouth is not the disease. It is the messenger. Layer 4. Dehydration and daily habits. As we age, the thirst mechanism becomes genuinely less reliable. The osmoreceptors that monitor your blood concentration get less sensitive. You can be measurably dehydrated and not feel any strong urge to drink. And when the body is running a fluid deficit, it prioritizes. It keeps blood pressure stable. It keeps kidneys perfused. It keeps core organs going. Saliva production is not at the top of that priority list. It is one of the first things to drop. Alcohol contributes in two ways. It is a diuretic, so you lose more fluid than the drink provides, and it has a direct local drying effect on oral tissue. A nightly glass of wine before bed means you go into 8 hours of sleep already slightly under-resourced. Caffeine in moderation is fine. Several cups spread through the day combined with sparse water intake and an evening drink will absolutely tip the balance. Smoking damages salivary gland tissue directly over time and shifts the microbial composition of the mouth in unfavorable directions. Highly salted foods draw fluid out of tissues locally. Acidic beverages create an oral acidity that reduced saliva cannot correct as fast as it should. None of these, in isolation, will ruin your mouth. Combined, they create the perfect storm the xerostomia you've been feeling has been trying to tell you about. Now I want to walk you through what actually happens if this stays uncorrected. This is where the morning symptom reveals what it is actually connected to. Aspiration pneumonia. This is the most immediately dangerous downstream consequence. Aspiration pneumonia is a lung infection that develops when material from the mouth, food, liquid, even saliva itself, enters the airway instead of the esophagus and reaches the lungs. The two passages start very close together at the back of the throat, and every time you swallow, a precisely timed little sequence of muscular events has to occur in the right order. Your epiglottis closes over your airway, your vocal cords adduct, your throat muscles contract, to send food the right direction. Saliva is what binds that food into a single, cohesive, slippery mass that travels cleanly. Without it, pieces break off. Fragments drift. Bits go the wrong way. In a young healthy person with sharp reflexes and a powerful cough, misdirected material usually triggers a cough response immediately and gets cleared. As we age, the cough reflex slows, swallowing coordination becomes slightly less precise, the safety margins shrink. And when a particle or a droplet does reach the lungs, it doesn't arrive alone. It arrives carrying all of the organisms that have been multiplying in the dry, unprotected mouth. The bacteria responsible are not harmless commensals. They are pathogens that a healthy mouth would have kept suppressed. When they reach the warm, moist, oxygen-rich environment of the lower airways, the resulting infection can be aggressive. Aspiration pneumonia is one of the leading causes of hospitalization and mortality in adults over 65, and chronic dry mouth sits at the very beginning of that chain. The dental cascade. Inside the mouth itself, the consequences build over months and years and tend to slip past people because they develop slowly. Dental decay in the setting of xerostomia is not the same as ordinary cavities. It tends to happen at the gum line and on root surfaces rather than on the chewing surfaces people normally associate with cavities, and it can progress unusually fast. The enamel that saliva was continuously remineralizing stops being repaired. The acid that saliva was buffering sits longer on tooth surfaces. The organisms producing that acid are no longer being swept away. People who have had reasonably healthy teeth for decades can experience severe decay within a year or two of developing significant dry mouth, and the speed of that progression catches them completely off guard. Gum disease and what comes after. Saliva normally keeps the bacteria that live between your teeth and along your gum line in check. Remove that check and they multiply. They trigger inflammation in the gums, and the inflammation breaks down tissue and eventually the bone underneath. Teeth that have been stable for a lifetime start to loosen. More critically, inflamed gum tissue is no longer a sealed barrier. Bleeding gum margins are essentially open doorways. Oral bacteria enter the bloodstream. They travel. They have been identified in atherosclerotic plaque. Chronic oral inflammation has been linked in published research to elevated cardiovascular and cognitive risk markers. These are serious peer-reviewed investigations, not fringe claims. And at the start of all of it is a mouth that isn't being properly protected, night after night after night. In severe cases, an oral infection can spread into the deeper tissues of the head and neck, or trigger sepsis, the body's catastrophic, life-threatening response to infection. I do not say this to frighten you. I say it to put the full picture on the table. The slow slide in quality of life. Then there are the things that don't kill you but quietly change your days. Chewing becomes uncomfortable. Swallowing
neck,
takes
or
focus.
trigger sepsis.
People stop eating foods that require effort.
Life-threatening response
Steak,
to infection.
raw vegetables,
I do
dense
not
breads,
say this to
apples,
frighten you.
and shift toward
I say it
softer,
to
more
put the full
processed
picture
options.
on the table.
Over time,
The slow
protein
slide in
drops,
quality of
fiber
life.
drops,
Then there are the
micronutrients
things that
become
don't
inadequate,
kill you, but
muscle
quietly
mass
change your
erodes,
days.
fall risk
Chewing
rises,
becomes
immune function
uncomfortable.
weakens, energy
Swallowing
drops.
takes focus.
And along with it,
People stop
bad
eating
breath,
foods that require
medically called
effort.
halitosis,
Steak, raw
becomes a
vegetables,
constant
dense
companion
breads,
that makes
apples,
people withdraw.
and shift towards
They
softer,
eat
more
alone.
processed options.
They avoid close
Over time,
conversation.
protein drops,
Social
fiber
isolation
drops,
quietly develops,
micronutrients
and
become
every
inadequate,
step of it is
muscle
preventable.
mass erodes,
So
fall
what
risk
changes
rises,
this?
immune
Here is
function
what I
weakens,
normally walk
energy
patients
drops.
through, in the
And
order
along
I
with
walk
it,
them through
bad
it.
breath,
1.
medically called halitosis,
Hydration cadence,
becomes a
not
constant
hydration
companion
amount.
that makes people
Do not try to
withdraw.
fix it with
They
one
eat
giant
alone.
glass in the morning.
They avoid close
Salivary glands
conversation.
respond better to
Social
steady input
isolation
than to flood
quietly
events.
develops,
Keep
and
a
every
water
step
bottle
of
with
it
you
is
during the
preventable.
day and sip
So
from it
what
regularly.
changes this?
Set a
Here
quiet
is what I
hourly
normally
reminder
walk
if you
patients
need
through,
to.
in the
Keep a
order
glass
I
of
walk
water
them
on the
through it.
nightstand and take a
1.
few slow sips both
Hydration
before you go to
cadence,
sleep
not
and the moment you
hydration
wake
amount.
up. If
Do
you
not
are
try
over
to fix it with
65,
one giant
do not
glass in the
rely on
morning.
thirst as your signal.
Salivary glands
Your
respond
thirst
better to
signal no
steady
longer
input
fires
than to flood
reliably.
events.
That is the
Keep a
physiology,
water bottle with
not
you
a
during
personal
the day
failing.
and sip from
2.
it regularly.
Oral
Set a
hygiene that
quiet hourly
compensates.
reminder if
Without
you need
saliva's
to.
protective
Keep a glass
blanket,
of water on
your
the
brushing
nightstand
routine
and take a
becomes
few
the
slow
primary
sips
line
both
of
before
defense.
you go to sleep and
Use
the
a
moment you
soft
wake
bristled
up.
brush and a
If you are over
fluoride toothpaste.
65, do
Brush
not rely
gently
on
for a
thirst
full
as
2
your
minutes,
signal.
twice a
Your
day.
thirst signal
Use
no
a
longer
tongue
fires
scraper every
reliably.
morning. A
That is the
meaningful share of
physiology,
the
not a
odor-causing and
personal failing.
acid-producing organisms
2.
live on the tongue.
Oral hygiene
Floss
that
nightly.
compensates.
Avoid
Without
alcohol-based
saliva's protective
mouthwashes,
blanket,
which
your
dry the
brushing
mouth
routine
further.
becomes the primary
Instead,
line of
rinse with
defense.
about a quarter teaspoon
Use
of
a
plain
soft
salt
bristled
dissolved in a
brush
small
and a
cup of
fluoride
warm water for
toothpaste.
30 to 45
Brush gently
seconds
for a
and let it
full
sit
2
briefly
minutes,
along your
twice
gum
a
line.
day.
Chewing
Use a tongue
sugar-free gum
scraper
or
every morning.
xylitol mints
A
after
meaningful
meals
share of the
stimulates
odor-causing
residual
and
saliva flow
acid-producing
and helps
organisms
suppress
live on the tongue.
karyogenic bacteria.
Floss nightly.
Crunchy fibrous foods
Avoid
like apples,
alcohol-based
celery,
mouthwashes,
and raw
which
carrots
dry
do
the mouth
similar work
further.
after meals if your
Instead,
teeth and
rinse with
digestion
about a quarter
tolerate them.
teaspoon of plain
3.
salt dissolved in a
Sleep
small cup of warm
environment
water
and
for 30
airway.
to 45
If you wake
seconds
dry,
and let it sit
run a
briefly
cool
along
mist
your gum
humidifier
line.
in the bedroom
Chewing
through the
sugar-free
night.
gum or
It will not
xylitol
solve
mints
mouth
after
breathing,
meals
but it
stimulates
will reduce
residual
the rate
saliva
at which
flow
moisture
and
leaves
helps
your
suppress
mouth during sleep.
karyogenic bacteria.
If you snore heavily,
Crunchy fibrous
if you
foods
mouth
like
breathe
apples,
habitually,
celery,
if your partner
and raw
has
carrots
observed
do
breathing
similar
pauses
work
during
after
sleep,
meals if your
please
teeth
bring
and
this up with your
digestion
doctor.
tolerate them.
A formal
3.
assessment for obstructive
Sleep
sleep
environment
apnea
and
is
airway.
worth doing.
If you
Treating
wake
the
dry,
underlying
run a
apnea
cool mist
improves the
humidifier
dry
in the
mouth and a
bedroom
great
through the
deal
night.
more.
It will
4.
not solve mouth breathing,
Gentle gland
but it will
support.
reduce the rate
Each
at which
morning,
moisture
and
leaves
again a
your
few
mouth
minutes
during
before
sleep.
meals,
If
take
you
a
snore
moment to
heavily,
gently
if
massage
you
your
mouth breathe
parotid glands,
habitually,
the
if your partner
area
has
in
observed
front of your
breathing
ears,
pauses during
just
sleep,
below the
please
cheekbone,
bring this
and
up
your
with your doctor.
submandibular glands,
A formal
under the jaw,
assessment for
along the
obstructive sleep
sides and
apnea
slow
is
circular
worth
motions
doing.
for 30 to
Treating
60
the underlying
seconds.
apnea
This
improves the
mechanically
dry mouth
encourages
and a
any
great deal
residual
more.
flow and keeps the
4.
gland tissue from
Gentle
becoming
gland
sluggish through
support.
disuse.
Each morning,
It feels
and
a
again
little
few
strange
minutes
at first.
before meals,
People
take a
report
moment
that
to
after a
gently
week it
massage your
becomes a
parotid
small,
glands,
pleasant
the
ritual.
area in
5.
front of your ears,
Reduce
just
the
below
things
the
that add to the
cheekbone,
load.
and your submandibular
Pull back
glands,
gently on
under the
evening
jaw,
alcohol.
along the sides
Pull
in
back
slow
gently
circular
on the
motions
late
for
in the
30
day
to 60
caffeine.
seconds.
If you smoke,
This mechanically
please talk to your
encourages
doctor
any
about
residual
cessation.
flow and
This
keeps
is
the
on its
gland
own
tissue
one of the
from becoming
largest single
sluggish through
oral health
disuse.
improvements you can make.
It feels a little
Reduce
strange
the
at
highly
first.
salted, highly
People
acidic
report
foods
that
and
after a week
beverages
it
where you
becomes
can.
a small, pleasant
6.
ritual.
The conversations to have.
Reduce
With your
the things
dentist,
that add to the
ask
load.
for a salivary
Pull back
assessment, a
gently
gum
on
health
evening
evaluation,
alcohol.
an early
Pull
decay
back
check,
gently
and a
on the late in the
conversation
day
about
caffeine.
prescription strength
If you
fluoride
smoke,
options and
please talk to
over-the-counter
your doctor
saliva
about
support
cessation.
products.
This
With
is
your
on its
physician,
own one of the
bring a
largest
current
single
list of
oral
every
health
medication and
improvements you can
supplement
make.
you take,
Reduce the
including
highly
over-the-counter
salted, highly
items,
acidic
and
foods
ask
and
specifically
beverages where
whether
you
any
can.
of them could be contributing to
6.
dry mouth and
The
whether there are
conversations to
alternatives
have.
or timing
With your
adjustments
dentist,
available.
ask
If your
for a
dryness is
salivary
persistent
assessment,
and
a gum health
unresponsive to
evaluation,
hydration and
an early
humidity
decay
changes,
check, and a
ask whether a
conversation
workup
about
for Sjogren's
prescription strength
syndrome,
fluoride
for
options
diabetes diabetes,
and
or
over-the-counter
for
saliva
autoimmune
support
conditions
products.
is appropriate.
With your
And if
physician,
lifestyle
bring a
and
current
over-the-counter
list of every
measures aren't
medication
enough,
and supplement you
prescription
take,
interventions are
including
available.
over-the-counter items,
Medications
and
to
ask
stimulate
specifically
saliva,
whether any of them could be
specialized
contributing
artificial
to dry
saliva
mouth, and whether there
formulations,
are
and
alternatives or
clinical-grade
timing adjustments
remineralization
available.
products.
If your
You
dryness
don't
is
have to
persistent
white-knuckle
and
this on water
unresponsive
and
to
gum
hydration
alone.
and humidity
A quick
changes,
word on what
ask whether a
reasonable
workup
progress
for
looks
Sjogren's
like.
syndrome,
In
for
week
diabetes,
1, most
or for
people notice
autoimmune
mainly that they are
conditions is
paying
appropriate.
attention.
And if
The mouth
lifestyle
doesn't
and
usually
over-the-counter
change
measures aren't
dramatically
enough,
in 7
prescription
days.
interventions
By
are
week
available.
2 and 3, with
Medications to
hydration
stimulate
cadence,
saliva,
salt rinses, and
specialized
gum,
artificial
morning
saliva
dryness is often
formulations,
somewhat
and
better.
clinical-grade
Tongue coating
remineralization
tends to thin
products.
out.
You don't
Bad
have
breath
to
typically
white-knuckle this on
improves
water
before
and
skin
gum
or
alone.
hydration does.
A quick word
Many
on what
people
reasonable
notice they are
progress
sleeping
looks like.
slightly better if
In
the
week 1,
humidifier and
most
airway
people notice
conversation
mainly that
are
they are
addressed.
paying attention.
By week 4
The
to
mouth
8,
doesn't
with
usually
consistent
change
practice,
dramatically in
gum
7
sensitivity
days.
and the early
By
decay
week
you
2
might have
and 3,
noticed at the gum
with
line
hydration
tend to
cadence,
stabilize.
salt rinses,
Chewing
and
comfort
gum,
usually
morning
improves
dryness is
noticeably.
often somewhat better.
Beyond 8
Tongue
weeks, with
coating
physician
tends
and
to thin
dentist
out.
support in place,
Bad
the
breath
deeper
typically
gains,
improves before
measurable
skin or
remineralization,
hydration does.
reduced decay
Many
progression,
people notice they are
improved gum
sleeping
metrics,
slightly better
easier
if the
swallowing at
humidifier
meals,
and airway
are where meaningful,
conversation are
durable
addressed.
change tends to live.
By week 4 to
Be
8,
patient.
with consistent
8 hours of
practice,
mucosal
gum
damage
sensitivity
every night
and the
does
early
not
decay
reverse
you
in
might have
3
noticed
nights.
at the gum line
But it
tend to
does
stabilize.
reverse when the right
Chewing comfort
combination of
usually
inputs
improves
is sustained.
noticeably.
If there is
Beyond
one
8
thing I
weeks
want you
with
to carry
physician
out
and
of this
dentist
video,
support in place,
it is that the
the
sticky
deeper
dryness
gain,
you feel when you
measurable
wake up is not a small
remineralization,
thing.
reduced
It
decay
is your body's
progression,
first quiet
improved
way
gum
of telling
metrics,
you that a
easier
system designed to
swallowing at
protect
meals
you has been running
are where
below
meaningful,
capacity all
durable
night,
change tends
and that
to
the
live.
longer that continues
Be patient.
uncorrected, the
8
longer the
hours of
downstream
mucosal
chain of
damage every
consequences
night
gets.
does not reverse
Your
in 3
saliva
nights.
is one of the most
But it does
capable defenders
reverse
your body
when the
has.
right combination
It
of
protects
inputs
your
is
teeth,
sustained.
your gums,
If
your
there is one
airway,
thing I
and
want
your
you to
quality
carry
of
out of
life.
this video,
What
it
starts
is
in
that
your
the
mouth
sticky
travels
dryness
to your
you feel
lungs,
when you wake
your
up
heart,
is not a
your
small
blood,
thing.
and your brain.
It is your body's
None of
first
these
quiet
are
way of telling you
exaggerations.
that a system designed
They
to
are the
protect you has
documented
been running below
pathways by which a
capacity all
small
night,
oral symptom
and that the
becomes a
longer that
large
continues
medical story.
uncorrected, the longer
Tonight,
the
before you
downstream
go to
chain of
bed, do
consequences
3
get.
simple things.
Your saliva
Put a glass
is
of
one of the
water
most
on the
capable
nightstand.
defenders your body
Start
has.
the humidifier.
It protects your teeth,
and make a note,
your gums,
actually a
your
written
airway,
note,
and your
to bring
quality
this
of
up
life.
at your next dental
What
and
starts
medical
in your mouth
appointment.
travels to your
That
lungs,
one written
your
note
heart,
is the seed
your
of
blood,
every
and your
other
brain.
improvement that follows.
None of these are
If this video
exaggerations.
was useful,
They are the
please
documented
subscribe and ring the
pathways by which a
notification
small
bell.
oral symptom
I post a
becomes a
new
large
video
medical
every
story.
week, specifically
Tonight,
tuned
before
for
you go
adults
to
over
bed,
60 who
do
want
3
real,
simple things.
practical,
Put a
evidence-grounded
glass of water
information
on the
rather than
nightstand.
expensive products
Start
and
the
cheerful head
humidifier.
fakes. And tell
make
me
a
in the
note,
comments,
actually a
what is
written
your
note,
morning
to
mouth
bring this
actually
up at your
feeling like
next
right
dental
now,
and medical
and have you
appointment.
connected it to a specific
That one written
cause?
note is the
I
seed
read
of every
every
other
comment.
improvement that
I will
follows.
meet you in the
If
next
this
one.
video was useful,
This is Dr.
please
Anthony
subscribe
Fauci.
and ring the
Take
notification
care of
bell.
your mouth.
I
It
post
is
a new
taking
video
care of
every
far
week,
more than you
specifically
realize.
tuned for